Hello, my name is Christina Cody and I teach science at Blacksburg High School. Today I'm going to introduce you to telehealth. And this PowerPoint was developed by Nurse Beatty at Mary Bramlett Elementary School. She's a pretty smart cookie. She's got lots of letters after her name, as you can see. So a telehealth program that we're going to bring to Cherokee County is going to be a partnership with the Medical University of South Carolina. This is a globally and nationally renowned institution. They're going to provide 100% of the funding, so it's not going to cost the district anything. They provide the training, the education, the equipment, and it actually supports our local healthcare providers. As you can see, telehealth is pretty popular already with the South Carolina Telehealth Alliance. So these are sites in our state that already offer telehealth, not school-based telehealth, but telehealth programs. And so there's 314 on the map, and I'm pretty sure that's a lot higher now. I think that's what our Dr. Cristaldi with the MUSC said. So why telehealth? Why are we even having this conversation? So if you check this map out, this is the medically underserved areas in South Carolina. And this is our need. We have just about 100% medically underserved in Cherokee County. So what does that mean? Medically underserved means that it's based on a few parameters. It has to do with your percent poverty, your ratio of residents to healthcare providers, the percent of your population over age 65, and then your infant mortality rate. So based on these factors, they determine which areas have the most underserved populations and geographic areas. You may hear telehealth, telemedicine, they're pretty interchangeable. However, telehealth is a little more broad as far as the services that's included with telehealth, where telemedicine is more in a clinical health, more acute. So the referring site will be the school when this is all set up, and the consultant site will be the provider. So I'm going to explain a little bit about what telehealth is. Here is a visit. So we have a student here with a nurse, and on the screen you can see here is her eardrum. Here's the doctor, half of the doctor, and so it's a virtual doctor's visit where this child may have come in with ear pain, and with this cart that is available through telehealth, it's got the tools that doctors need to provide the vitals in real time with the doctor on the other end of the camera. So here's an otoscope showing this child's eardrum. It's really, really cool. It's just a virtual doctor's visit through a secure Skype or video conferencing connection. So you want that secure for good reason. So surveying the perceptions of telehealth and what patients think of them. A lot of patients are comfortable communicating through telehealth. They actually like the convenience of it and the access to care. Many were actually less stressed through a video conference than they were with a real-time or in-person visit. So 52% of hospitals currently use telehealth, and another 10% are beginning to use it. Here's another view of school-based telehealth. So you have the student, the nurse, the provider on the other end of the Skype visit. And here's an example of a cart with the tools available. So it is a real-time, face-to-face doctor's visit. So the process of getting all this started, of course we would need parental consent to have a visit with a telehealth conference. So you have a student comes in with a symptom, the nurse can refer the student. So the nurse would call the parent and say, you're more than welcome to come in and we can have this doctor's visit right now. Or you can stay on the phone and do that over the phone. Some things that we're going to offer in the Cherokee County program are, of course, just acute illnesses, and then mental health, and then an obesity management program. And I'll talk about that in just a little bit. So the telehealth appointment would be provided by the local healthcare provider. There'll be an exam done right there virtually. There's a diagnosis, a treatment. If you need a revisit, that's possible. And then, of course, you can follow up with your local provider as well. So the student may be able to return to class. And of course, we just had a doctor's visit right there. You didn't miss school, and your parent didn't miss any work, maybe if they were on the phone. So it's a great opportunity just for convenience, for access, and to save time and get our students right back to class. So telehealth does not include well visits. So for an annual exam that you would have, it's not for that. So it's for common symptoms, chronic conditions like asthma and ADHD, and then specialized mental health care. So in Cherokee County, we are really underserved with mental health services. Of course, our Department of Health, mental health does a great job, but there's so many cases, and the availability of providers is actually 2,010 to 1 in Cherokee County. So there's a great need for mental health services, and hopefully telehealth is going to be able to provide some relief for that. And then the pediatric obesity management program, Cherokee County would be the first in the state to have this service and to pilot it. So that would be awesome. As far as the community benefits go, hopefully this would reduce the amount of emergency room overuse. It will save time and money. It increases our local provider access, keeps a lot of resources local, and it reduces the delays and gaps in care. So if I have ADHD as a student and I'm medicated, then every 30 days I have to go to my doctor to be reevaluated to make sure that the medications that I'm on are working and I'm successful in the classroom. Well, I can't always get to the doctor every 30 days. Sometimes I may not have transportation, or my parents can't get me to the doctor at a certain time. So with this technology, I will be able to visit my school nurse, have my visit, have the assessment done there, have a prescription ready where all I have to do is pick up my prescription. And so I won't have to go 2 or 3 weeks without my ADHD medication that's helping me in class. And so I'm more focused, and that's 2 to 3 weeks of success. So I think it's going to be really beneficial as far as treating those types of challenges. It also supports the whole school, whole community, whole child model that research shows improves school environments and student success. I'm not going to miss a lot of class time as a student. I am able to avoid lost time for my parents from work. So, and then of course it increases my student academic performance, my overall health, and improves classroom behavior. So that's what the data is telling us, and we want to see that in Cherokee County. So why Mary Bramlett? Why this great program? Why only Mary Bramlett? So they really want this service to have the biggest impact in the schools that need it the most. So Mary Bramlett is a South Carolina Department of Education priority school. There are health disparities there based on race and socioeconomic status. The rate of asthma emergency room visits is high among the students there. And also the percentage of Medicaid and free and reduced lunch status is a factor as well. There's a high prevalence of ADHD and mental health needs, and again, the health disparities, those gaps. So there's really strong need there. Here's some BMI data from the 5 years we've been collecting data, and then this most recent school year. As you can see, the overweight and obese data is really high for first, third, and fifth graders. And this is alarming in that obesity is a major risk factor for diseases, a lot of diseases like cardiovascular disease, and even cancer. And so we really want to make sure our students are in a healthy place, to where they can develop fully and be the most successful. So this program that we're offering through the pilot program, the Pediatric Obesity Management Program, will provide registered dietitians and life coaching and these specialized services for students that need it the most to improve their health. So mental health services, there's lots of barriers to mental health. Of course, there's a societal stigma, transportation issues, caseloads, the need for specialized counseling that may not be local to Cherokee County, wait time, and access. And so this is going to provide us a way to get that specialized care to our students, and may even triple the amount of time with providers and with counseling that we can offer our students in partnership with the Department of Mental Health. Here's some data from Mary Bramlett on mental health referrals, and this is from November to February. As you can see, there's a great deal of need, and so this specialized counseling can be done in school. We can identify the specific needs of those students and have convenient access to mental health services. So I hope that this has kind of given you an idea of what telehealth is, and I hope that you're excited for Cherokee County, because I am. And this is gonna be a game changer for a lot of students that need the basic things so they can be better students. So here's some resources that you can look up if you want to learn more about telehealth. And if you have any questions, I apologize, we're not there in person. There's just a crazy schedule going on right now, and I'm out of town too. But if you want to email us with your questions, there are 2 emails listed there, and we will be sure to get back to you with those answers. So thank you so much, and we thank Dr. Moore for supporting this and wanting to make sure that our students in Cherokee County have the best possible foundation to be responsible citizens in Cherokee County. So thank you so much.